I'm Dr. Anthony Cave, and this is 54-year-old nurse Stephanie Phillips Seawick. Stephanie appears to have forcibly removed jewelry from patients, breaking their fingers in the progress, possibly using one of these blue tourniquets, which we're going to talk all about today because we use them sometimes in the operating room before surgery as well, and is now charged with at least 3 cases of rather egregious attempts at elder, essentially abuse, but robbery and battery. And what happened in this case is important for you to know because many patients lose expensive things, not just rings and bracelets and jewelry, but other things that I'm going to share with you so that you hopefully don't put yourself in a position to accidentally lose precious items in an already stressful situation like in the hospital. And I'll specifically share with you the tricks that we use in the operating room to remove jewelry because we need to do it sometimes against patients' will. You probably didn't know that. But let's first start with the first patient that Stephanie stole the jewelry from. This was an 87-year-old woman who appeared to have dementia, fell in her retirement home, was transported to the hospital wearing 4 rings. At least some of them belonged to her deceased husband. She was later sent back to her retirement home that day, missing her rings. What happened? Well, later found that she not only was missing rings, but also had a dislocated finger and a fracture, which a doctor's evaluation found not to be related to the initial fall. The cat came out of the bag when Stephanie admitted to using hand sanitizer to remove the rings. Why use hand sanitizer? Why use blue tourniquets? I will discuss the whole story after we talk about the second case, which involved a 95-year-old woman wearing an 18-karat golden bracelet to the hospital and suddenly found it no longer on her wrists. Now, there's probably more cases that are being uncovered as we speak in this bizarre turn of events from this clearly nefarious individual. But why do we use sanitizer? And why should you be super mindful of jewelry like earrings and bracelets, maybe having your wallet with cash in there, expensive sunglasses, hearing aids in particular, or even reading glasses? We're going to talk about all of those, and importantly, thank you to all the members that help this channel continue to do what it does. If you always join, it helps me do more of this for you. So the first issue is that a lot of jewelry is tight-fitting in patients. Tight-fitting jewelry, especially in emergency situations like surgery or the emergency department, require us to remove jewelry because of the risk of swelling. Now, I'm not saying you should break a patient's finger to remove jewelry or take it against their will if they are awake and able to consent. I'm talking about why we use hand sanitizer in appropriate settings to remove jewelry, like rings that are tight-fitting that we need a little bit of lubrication to pull off. Hand sanitizer is kind of my weapon of choice. Weapon is a bad word, but you know what I mean, because it will evaporate very quickly versus surgical lubrication or water-based lubricants that will stick around for a while and my fingers get very, very wet and I lose my grip. The second thing we do is with tourniquets like this. So what my trick is, if someone has a ring on that won't come off before elective surgery and we need to take it off because of the risk of swelling, is that I will wrap the finger with one of these tourniquets from the top and I'll work my way down so that I get the blood coming out of the finger. The more I wrap it, you'll of course notice that it's going to get skinnier and skinnier. Then I have the patient elevate their hand to further help the blood drain out so the finger gets skinnier and skinnier. After waiting 2 or 3 or 4 minutes while I'm doing my medical interview, this is the quick part, right? I got to take it off quickly, put a bunch of that alcohol on, and then I'll try to quickly pull that ring off. Now, realistically, if there is a finger that's swelling up, maybe from excess fluids from an IV, maybe from trauma, and the body is now causing inflammation and swelling, we sometimes need to cut these rings off, which is why if you have any ability to plan ahead of time, you shouldn't wear jewelry before you go to the hospital, especially rings or bracelets. But that's not what happened in this case. To be very clear, Stephanie was doing this against patient's will without a medical reason. but the same advice holds. If it's tight fitting, don't assume it's gonna not fall off. Take it off ahead of time. Who do you leave it with? I always ask patients to leave things at home, but if they come to the hospital and they're already in the operating room area, I ask, either I'll hold on to it personally, because then I tell the patient before they fall asleep, ma'am or sir, I am going to personally be responsible for your reading glasses, for your hearing aids. These are very expensive items, and surgery is already very expensive as is, needless to say. But short of trusting your doctor, who should be doing other stuff with their time, hopefully, try to leave it with a family member. You can give it to the nurses. And of course, the vast majority of nurses are not a problem here. But in general, I want you to be mindful of who you are entrusting your valuables with. The last thing you want during surgery is to be concerned about identity theft from your wallet maybe being stolen while you're having surgery, instead of focusing on your healing and your positive surgical outcome. So I hope that that helps you appreciate who to leave your stuff with, what items that you might forget to take off, especially the hearing aids, and maybe bringing your wallet if you don't need anything beyond your ID or your driver's license. And how we do it, I told you how we will often remove those rings in appropriate medical settings with the right indication with the patient's consent. And I hope that you know what not to bring to the hospital. I want to do live Q&A with you guys because this story is just so weird. I had a lot of questions for what happened here. I see Chris RN's already saying, unfortunately, doesn't surprise me. Well, I would hate to say that I agree, but it doesn't surprise me that 1 out of a million nurses might do something like this. It's certainly not the norm. I'm in the advice business. Don't wear real jewelry, wear only fakes and tell everyone so you aren't targeted. Daryl, that's not a bad idea, especially if you're coming to the operating room. On that topic, I think I have a couple of videos on wearing makeup as well. A lot of folks wear a lot of makeup, and that can also be problematic before surgery. If you know why, tell me in the comments below, because not a lot of folks think about this. Brittany says, my husband will take mine or the nurses have it locked up. Very good, Brittany. And I hope that maybe in the future, you just don't bring as much if you don't need to. Very good question. Monica, good to see you on here. I try to leave everything at home unless I have a seizure or anything, and my home healthcare treatments would send my phone and charger with me to contact someone. So if you have something like epilepsy, or if you have an allergy to something, or if you're a type 1 diabetic, or you have malignant hyperthermia, you can always wear a medical bracelet. No one's saying to not wear the appropriate type of jewelry in that case. That can come with you to the hospital, needless to say, and should come with you no matter where you go. Very good point. Straight talk. Why aren't women told to not wear nail polish? I think they are. They just often don't listen, and the vast majority of surgeries and anesthetics go safely without it being an issue, so a lot of people don't make a big deal about it. But nail polish we can usually remove. We may have to rip a nail off, which you've had to do from time to time if the pulse oximeter won't fit on the nail. Because if it's between the nail health or your health, I'm typically going to favor my patient's health. But you tell me what you think. I mean, if you would rather keep the nail, then maybe we can't have you sign the consent. Susie Go, good to see you, and thank you again for being a member. Makeup doesn't allow stickers to stick where they might need to. Well, that's one issue. And makeup, like Monica says, can also mess with some of the equipment. Sometimes the makeup might prevent us from seeing color changes. The vast majority of surgeries are not involving people turning white from bleeding out or turning blue from not getting oxygen. But if you're wearing makeup, it will only make it that much harder to observe what's going on. But maybe more practically, like Susie said, it might prevent certain stickers from sticking on you. The big one I have is for the tape to close the eyes. If there's heavy layers of foundation, sometimes the tape won't even stick. Eye makeup can scratch your eyes, says Jerry Lynn. It certainly can. I hope you're not applying makeup when you're coming out of anesthesia and accidentally scratching your eye. But corneal abrasions are one of the most annoying complications that can take weeks and weeks to heal. Very good point. Avatar Angelica, do surgeons / anesthesiologists often use local anesthetic as well as anesthesia at the same time? Yes, we do, for many reasons. I have a whole video that actually I did on this last week about how you can combine nerve blocks with general anesthesia to help provide safer anesthesia and surgery to patients. Brittany says, last week I woke up from anesthesia. So agitated, they had to sedate me again because I was pulling the oxygen in tubes. That has never happened. Brittany, I'm sorry that happened, but recognize that many people might have a reaction to surgery on one day and a different reaction the next day. It's not too different from how we wake up. Some mornings we wake up like maybe really groggy and just like everything feels like an uphill battle. Other mornings we feel refreshed and we're able to just jump out of bed and get our day started. For the same, I gotta say, it's the same in the ketamine infusion clinic that I run, where some infusions on some days are very positive. On other days, there are maybe some more turbulent experiences. This is how all altered states of consciousness appear in individuals. Human beings don't have the same experience every time, whether it's when we're dreaming in our sleep, whether it's through a ketamine-like experience, or whether it's anesthesia. So I'm sorry you had that experience, Brittany, but I wouldn't want you to be put off and think that I'm always destined to have this type of reaction to anesthesia. Can makeup cause an infection during surgery? Monica, well, it can if there is a break of skin or if there's some penetration of dirty bacteria on the makeup. It's a bigger deal for dirty nails if someone is having surgery in their hands or if the person doing the procedure has artificial nails that might have accumulated a lot of bacteria because they can't be cleaned hygienically and reliably. La Condesa Latina. Can you explain malignant hyperthermia versus Raynaud's when having surgery? Latino, very, very different conditions. Very good question. Malignant hyperthermia is the lethal anesthetic allergy caused by the gases that come out of the ventilator behind me or from succinylcholine, one of the muscle relaxing medications. It is very different than Raynaud's, where nearly anything can trigger your fingers to become very cold from a very exuberant fight-flight response. So when I do stellate ganglion blocks on patients to calm the fight-flight response, Raynaud's completely reverses because it vasodilates, it relaxes all the blood vessels in the hand. And it's actually one of the indications for the block to help restore blood flow in what we call critical limb ischemia. Very good question. Very good question. Straight talk, good to see you. I am very academic, and due to that, I get breathless. Oh, anemic, I get breathless. So would being under anesthesia affect it in any way? Yes, it would, because when you are under anesthesia and presumably having surgery, if you're anemic, you can't tolerate that much more blood loss. We need to be extra mindful about giving you the right repletion, transfusion, to make sure that you can still carry enough oxygen to your brain and your heart and your kidneys to prevent things like heart attacks and strokes. Very important question. Please tell your doctor if you're prone to anemia or if you've had a very heavy period, for example. We need to know if you're having especially major surgery where the risk of blood loss might be high so that we have the right blood tests done in advance. Brittany, did my diagnosis of EDS impact how I react to anesthesia? Does my diagnosis? It might. It might, because folks with EDS might need more anesthesia. Not all anesthesia medications, but some of them. In particular, perhaps pain medications like opioids. They may respond differently to certain nerve blocks, though the evidence is quite varied. You need to tell your doctor, Brittany, so that your doctor can make the assessment for what needs to be adjusted in your anesthesia. Very good question. And let's end with one more question. I'm looking at what's coming in the pipeline here. Can you dream under anesthesia? And I'm allergic to atropine. Okay, maybe we'll end with both of those because they're such good questions. Rebecca says, I'm allergic to atropine. Is that dangerous when having surgery? Yeah, because atropine is one of the life-saving medications used in our bradycardia guidelines. When someone's heart rate goes very low, we use this age-old medication that comes from the belladonna plant called atropine to help raise the heart rate. If someone's allergic, I first wonder what the allergy is. If it's tachycardia, that is an expected effect. If it's something else, then I might be a little bit more concerned about its use, but you absolutely need to tell your doctor so that we can use other medications like glycopyrrolate or maybe transcutaneous pacing in the event of a sudden bradycardia. And Julie Ford, can you dream under general anesthesia or are you very far away? You're both, Julie. I had a patient today who told me they had the most pleasant dreams during their surgery. Who would figure, huh? You can dream. It depends on many factors. I have a video coming up on this in just a little bit. You should check it out. But it depends on the medications you receive, on what you're thinking about before you fall asleep. It depends on what conversations might be happening in the operating room before you fall asleep. Just like your regular sleep at night, on what can influence your dreams before regular REM sleep, can also happen during sleeping under anesthesia. Even though anesthesia technically is not sleep, there's still a lot of resemblances in these two altered states of consciousness. What great questions. I hope you all remember the take home for today, which is to not bring expensive things, especially eyeglasses and hearing aids, if you can avoid them coming into the hospital, so that you minimize the risk of expensive things being lost or stolen. And if you leave them with someone, leave them maybe with the doctor or a nurse that you trust, or better yet, a family member who will hold on to them the whole time. I'm not saying you can't trust doctors or nurses, but I'm saying if you can leave it with a family member, it might give you that much more peace of mind, which you deserve in stressful situations like here in the operating room. Until next time.